Pre-operative instructions. You will be undergoing an oral and maxillofacial surgical procedure with the help of sedation or general anesthesia. There are some important instructions that absolutely must be followed for you to have a safe and comfortable experience. You may have absolutely nothing to eat or drink for 8 hours prior to your surgery. This rule is for your safety and must be strictly adhered to. If this rule is not followed, your procedure will need to be postponed to a later date. The risks involved can be serious and life-threatening. Medication should be taken with a small sip of water prior to the procedure. An escort is essential as well. A responsible adult escort must be present at the time of your surgery, be able to stay throughout your surgery, and be able to safely take you home to make sure you are recovering well after the operation is over. You will not be able to take a bus or taxi by yourself. Anyone under the age of 18 must have a parent or legal guardian with them. Please wear loose-fitting, comfortable clothing and preferably a short-sleeved shirt. This helps us with starting an IV and also makes attaching any necessary monitors much easier. Any tight-fitting clothing may have to be removed to properly and safely have access to you. Please do not wear any cosmetic makeup on the day of your surgery, including nail polish or acrylic nails. This can affect the monitors we may use. Please inform the doctor of any changes in your medical history prior to the day of surgery. If for any reason there are changes, it may be necessary to change the date of surgery or for you to be checked out by your primary care physician. What to expect on the day of surgery. You will be greeted by the office staff and brought to the sedation room. The doctors will review your history and chart and ask you if there are any changes. A small IV will be started in your arm or hand, and all of the medications from this point forward will be given through the IV. The doctor will begin to give the IV medications, and you will become drowsy. At this point, you will no longer remember the procedure. When you come to, the procedure will be complete, and you will still feel sedated. It will take a little time for you to recover until you feel up to walking and talking again. You will continue to be monitored until everything is stable and you are ready to go. Your escort will be invited back to the surgical suite, and the post-operative instructions will be given verbally as well as in written form. At this point, you will be able to walk and talk without much help, but you will still feel drowsy. Your escort will be able to take you home. If you received any prescriptions prior to surgery, please fill them immediately and use as follows unless instructed differently. Amoxicillin. Please start the day prior to the surgery and continue 2 times per day until completed. Amoxicillin. Please take all 4 tablets, 2 grams, 1 hour prior to your appointment with a small sip of water. Clindamycin, Cleocin. Please start the day prior to surgery and continue 3 times per day until completed. Clindamycin. Please take 2 tablets, 600 milligrams, 1 hour prior to your appointment with a small sip of water. Medrol dose pack, methylprednisolone. Please begin the day prior to surgery and follow the instructions on the package. Paradex oral rinse, Chlorhexidine gluconate. This is a topical antibiotic mouth rinse. Please start the day prior to surgery and rinse with 1 to 2 tablespoons for 3 minutes and then spit it out. Use this 3 to 4 times a day. Continue this medication after surgery once rinsing is allowed.